Good morning, everyone. You're all welcome to another exciting time, another webinar, another time of the month where we come, we bring you good news, we talk about a lot of things concerning all of us. So today we're talking about primitive reflexes. Yes, we're talking about child development, baby movement. You know, when you give birth to a child, you want to understand how they move, how it works, and everything. Today, we're going to be discussing all about that. I want you guys to just sit, listen throughout, ask your questions, send in questions, contributions. We're going to be online to answer all your questions. Thank you guys for joining. Just please stay tuned, listen. You guys are going to enjoy this session. Today's webinar, we have our host already in the studio, all the way from our Wuse 2 branch here in Abuja. She came all the way to deliver this amazing message to us. We have Dr. Mitchell. Yes, Anyoku, please, we have her in the studio already, so she can join us now. You can come in, Dr. Michelle. You can come in.
Hi, good morning, everyone. So, like she said, I'm your host for today. My name is Michelle Anyoku, and I will be talking about primitive reflexes. Basically, let's forget all the big grammar and all the and so primitive reflexes are your baby's body automatic movements. Like when a baby is born, at every stage, there are certain movements, there are certain body movements, body functions, certain responses that a child is supposed to have. So sometimes, because of its life, during the process of a gestation, during gestation period, and some cases, external factors could actually come in, and these children, or maybe some babies now, will not be able to follow the normal sequence and will not be able to react the way they are supposed to. So we're trying to guide you now to educate you on basic movements your child is supposed to have at every point in time and for every particular month or weeks. So if you know what to look out for, you can tell when your child is not developing properly. If you know what to look out for, you can tell when your child is lagging behind. And one thing we all know about health is early detection is key. So if you know what to expect and what to look out for, you know when your child is not actually doing the normal stuff, then you can go to you can go for a consultation to actually find out if something is wrong. Because if there's something wrong, when you start treatment early, it's actually better, and the prognosis is better for the child compared to when it's been a very, very long time. And we all know with health, something that was caught early definitely always have a better outcome. So according to Son 2011, primitive reflexes, also called neonatal reflexes, can be defined as involuntary motor responses originating in the brainstem and present after birth in early child development. So basically, keyword, neonatal reflexes, babies, children of a certain age. It's an involuntary motor response. Involuntary means something that you don't have control over. Do you understand? So that is it's something that is supposed to be there. It's involuntary, and it's a motor response, meaning it's a movement originates in the brainstem and is present. Now, these involuntary motor responses are eventually inhibited as the brain matures and are replaced with voluntary motor activities. So as the child gets older, because in as we know what to look out for, another reason for this webinar is you also know when it's supposed to stop, because these reflexes, they come and there's a certain time, we call it integration. Integration of a reflex means that this is when this reflex is expected to disappear. So if your baby is supposed to maybe have stopped doing this and the child is still doing it, that's another reason for you to come in for a consultation or to take the baby to a neurologist. So they are replaced with voluntary motor activities after the integration, which means those involuntary motor responses that child was making are now replaced with voluntary movements. Like the child now is the one in control of certain movements. So these reflexes play a developmental role, like I said, preparing the child to move against gravity. And it gradually leads to like the voluntary movement, like I also said. They exist to enhance your chances of survival. Do you understand? So basically, the fact that we're here today and we can do everything we're supposed to do, it's because we had these reflexes and they all integrated when they were supposed to integrate. Now, the persistence of these reflexes beyond the usual ages suggests that there's a brain injury somewhere. Now, they are lost as the pyramidal tracts gain functionality. Basically, that's like as the child is getting older, the brain starts to the integration basically. That's why we're talking about different reflexes today. So every reflex now has its own integration. So it just means that for a particular reflex, when it's that time for it to integrate, it disappears and is replaced with a voluntary movement. Okay. So signs of exactly. So now let's talk about the signs of primitive reflexes. What to look out for that lets you know that okay, there's something wrong going on. There's a poor hand-eye coordination. Like hand-eye coordination, basically like this is an example of a hand-eye coordination. This is one of it. Another one is normally all of us here now. Like I'm still going to talk about it in broader perspective, or the blink reflex, for example. All of us are adults. If someone is bringing something close to your eyes, you definitely avoid it. It didn't just start today. It's one of those reflexes we're talking about. So basically, when there's a poor coordination, incoordination of the muscles and all, you can tell that this child maybe is not standing well, or is not sitting well, or can't walk properly, or when you just see like this movement that you feel like, okay, this is not normal. Because I know sometimes some people actually notice these things, but they are being told that, oh, it will depend, the baby will adjust as time goes, he will get better, it's how they behave. If you notice anything, go in and check. It's better you go and check and you're told that, okay, false alarm, there's nothing wrong, than you sit down there waiting for it to correct on its own and there's actually a problem going on. So also there's the hypersensitivity and hyposensitivity to sound, touch, and movement. Now, hyper means increased, hypo means reduced. So the hypersensitivity now means normally, if you notice, sometimes when you bang a door, the baby will jerk sometimes. That's a reflex. It's normal. But sometimes for some babies, when this hyposensitivity now, when there's a reduction to the sound, touch, or it's increased than normal. Like if you notice that your child reacts more than normal, or your child reacts less than normal, then clearly you should know that, okay, maybe there's something going on that isn't supposed to be there. Poor posture is another one. You'd see we've had some babies come in and the mothers are like, he doesn't sit well, she doesn't sit well. Some will say she's not sucking properly. Poor posture. If you notice your baby or your child is not, the posture is not, a baby is supposed to sit at 6 months or thereabouts and be able to sit, like support their back. But if you notice it's 7 months and your child is still lagging behind, you put him or her to sit and the baby is trying to fall over in front, and then there's a problem. Now let's get into the main order of the day. Types of primitive reflexes. There's the general body reflex. Well, I'm going to list all of them out. Then after listing, we'll take each of them one after the other. You have the motor reflex. You have the plantar grasp reflex, the palmar grasp reflex, the walking stepping reflex, your limb placement reflex, your asymmetric tonic neck reflex, your symmetric tonic neck reflex, your Babinski reflex. You have your parachute reflex, your Landau's reaction reflex, your withdrawal reflex. Now, like I said, don't worry, we're still going to take all of them one after the other. You have your Gallant reflex, your tendon reflex, your flexor withdrawal, your cross extensor reflex. Then that is for the general body. Then you have your facial reflexes. You have the nasal reflex, the blink reflex, the doll's eye reflex, the pupillary reflex, and the auditory orienting reflex. Now for the oral reflex, you also have your rooting reflex, your sucking reflex, your swallowing reflex, your gag reflex, and your cry reflex. Okay, so retention of primitive reflexes, that is, these reflexes being retained and not leaving when they're supposed to, can be caused by a variety of factors. The birth process is a key factor. So like when a child is being born, it's a critical time because something that was done wrong could actually go on to cause a lot of damage. So birth process is key in the sense that for our mothers who are expecting, if you feel any sort of way or you feel something that's you, so long as you don't feel right, please go in and check. There's also this belief that labor is supposed to be, let me not say a belief because it is a thing. Labor is not easy. It's hard and it's painful. But actually, some women have labor that is not as intense as what it is believed to be. There was a case one time of a woman who she was in labor and she did not even know because to her, she believed she's supposed to be screaming in excruciating pain. But funny enough, she was very calm and the labor was going on, but she didn't know. And when she eventually came into the hospital, it was already late, and this child was born, and there was a lot of problems. So now imagine if maybe because she had felt somehow, because in as much as we're saying she was calm, it doesn't mean she wasn't feeling some things, but she felt, oh, it's just normal. She's waiting for that intense, excruciating pain and all. In as much as we have certain norms and everything, when it comes to health and body related concerns, you cannot say for certain. Everybody is not the same. It's the same like the pain management and all. In as much as two people might come down with the same medical condition, trust me, the way they tolerate pain is not the same. Everyone's pain threshold is different. And that is the same thing for labor. So birth process is very key. Once you feel anything, please go in. And then it's also like the medical staff who are also attending to also make sure that the right things are done so that children who are fine don't come out and develop neurological deficits that are not supposed to be there. Then other causes also include jaundice, that is the yellowing of the eye. So as your baby is born and you notice that the eyes are turning a bit, it might not be like very yellow, but you notice it's pale. It's not the normal color. Go in and check that. Then also head trauma. We've been told that, let me say, babies are not, when you carry a baby, some people, they hold your baby and they're throwing the baby up, they're shaking the baby. It's not actually supposed to be normal because we are stronger than them. They still have a lot of development going on. The head trauma we're talking about, you don't necessarily have to hit the baby in the head for the trauma to happen. Sometimes shaking a baby can actually, cause some things. And you're just there. It was done innocently. You're just playing with the child. Yes, but some things are not supposed to be done. Then also chronic ear infections. Sometimes some children are born and there's a bit of ear infection. That's the thing. These days we tend to be like, oh, just manage it. It will be fine. It's nothing to worry about. Buy eardrop. When it comes to children, even we as adults, the littlest things, go in and check it out. I always say it's better you check and there's no problem than you leave it and there's actually something going on. So now let's talk about the reflexes one after the other. So first and foremost, we're doing the moral reflex. It's also called the stator reflex. This is developed between 28 and 32 weeks of gestation. Gestation here is pregnancy. Let's just use pregnancy. Let's not use big grammar. So it's developed between 28 and 32 weeks of pregnancy. Now, this is when it is developed. Now, when your baby is born, the stator reflex is there. It's there when your baby is born. And when this reflex should start to disappear is from 3 to 6 months. So some children, you might notice that at 4 months, it's no longer there. 5 months, 6 months, this is the normal range. But a child of 8 months, 9 months, still having the stator or moral reflex, that is a call for concern. So now, how to actually go about this? The process, when a baby is held lying, when you're holding your baby, your baby is facing up or the baby is lying. Now, you allow the baby's head to fall back suddenly. You would notice that there is a sudden startle. The child is like, I don't want to fall, to catch myself. Remember that I said these reflexes protect us against gravity. So that is what the Moro reflex looks like. Your baby is lying facing up, and maybe you try to drop the head back, and the baby just jerks himself up. That is what the Moro reflex looks like. So that reflex is supposed to be there for at most first 6 months of life. Anything from 7-8 months for the Moro reflex, then you need to be worried and you need to go in for a consultation. And the reflex, when this head is allowed to fall back, so the baby just opens the arm and then there's a cry after that. That is what it's supposed to look like. So when you don't see that, for those who maybe you have your child and you try to do this and there's no jerking, there's no adduction of there's no movement of the arm because the child opens the arm. It's an involuntary movement. So it's not even like it's something that you try to do it and the child just goes like this and then there's a cry afterwards. So that is what it is supposed to look like. The significance of this absence of the Moro reflex actually indicates that there's a brain lesion and there's a peripheral nerve injury to the upper limbs. That is what it means. A child of below 6 months who doesn't have the startle reflex, you need to go in because it means there's something wrong with the peripheral nerve and the upper limbs are affected as such. So that is for the Moro reflex. This is what this reflex is supposed to look like. I think you can see my screen. Then the next is the palmar reflex. Call it the palmar grasp sometimes. So this is actually present too from birth to 5 or 6 months, thereabouts. So basically, this one is a very common thing. You might place maybe a finger in the palm of a child and the child just closes their palm over it. I'm sure this one is something everybody is like very familiar with. When you put something in the palm of a child, they close their palm against it. So granted that this is a reflex we all know about, a child of 7-8 months should no longer be having the palmar reflex. So the significance of this reflex is that after the reflex has left, after it has integrated, the child now can reach for objects by his or herself. So like after the palmar reflex has gone, he or she can decide to reach for the table themselves and grab onto it themselves. That is the essence of this particular reflex. So you understand, from birth to that 6 months, you place your hand there and the child closes their palm over it. That is the normal palmar grasp reflex. After 6 months, the child it's not supposed to be there anymore. You could place your hand, the child might decide not to reach for it. It becomes before it was involuntary, that once you do it, they close their palms against your hand. Now, it should become a voluntary action that the child might decide or not decide to reach for your hand or other objects. Then we have the routine reflex. Basically, what happens here is when a baby is touched around the cheeks, just the corner of the mouth, just very lightly. When you touch the corner of the mouth or you stroke it, the baby will turn his head towards that hand. So if you're doing this, your child is trying to move this way. If you're doing this, your child is trying to move this way. That is what the routine reflex basically means. So this should start to disappear from 4 months. 4 months, you shouldn't be getting, from 4 months upwards, you shouldn't be getting this anymore. If it persists, it might actually like disturb the child's sucking. So you know what to expect from the routine reflex. Now, the next is, since we mentioned sucking, let's do the sucking reflex. It's also known as the swallowing reflex. This is also from birth to 4 months too. So when you place the nipple or the pacifier, when it's placed in the baby's mouth, the automatic reaction is that the child starts to suck. it's an involuntary automatic reaction. You understand? Now, the thing is, from 4 months, it integrates and becomes a voluntary reaction. That's why sometimes you can now see that maybe for children of 5 months, 6 months, you might place the pacifier and they might not want it. For some of them, you might want to give, when they are done breastfeeding and they don't want it, they just push it away. Because now it's a voluntary stop. It's no longer the time when you just put it and it's an automatic reaction to just suck. So the sucking reflex gives room for that voluntary swallowing. That's basically what it does. Now, persistence of this sucking reflex automatically means that the child might be having some swallowing difficulties, not because this reflex has now stayed longer than it is supposed to. Next, we have the Landau reflex. This reflex doesn't start from birth. The first time you should start seeing this should be from 3 months. 3 months to 12 or 24 months is quite normal. So even if your child is 2 years and you're still seeing this one, it's okay. But children of 3 years should not be experiencing this one, where the child is placed to lie on their abdomen. Child is placed to lie on their stomach. So as child is lying on the stomach, they are supported in the air. You know, you just carry the child, but child is lying on the stomach. What you will notice is that they will want to do this. They'll try to like push their head and their back and their neck like towards the ceiling. So basically, it's what it helps is as the child does that, it helps to break the flexion pattern that is seen at birth. Flexion is the bending of a joint. So that is what this reflex is for. It can last for up to 2 years. It's very, very tricky. From 3 months to 2 years, it's quite normal. But 3-year-old kids, it should no longer be there. Now you have the asymmetric tonic neck reflex. This one can come from birth to 6 months. So basically, if your child is lying, you just place the baby on the bed, you'd notice that sometimes they tend to turn their neck to one side. It's actually a normal thing for children who are 6 months and under. When they are placed on the bed and then the neck is just turned to one side. It can actually be any side. There is no particular side that is, it could be any side of their choosing. But when they are lying facing up, the neck is turned to one side, especially when they are sleeping. You would notice that. If this particular reflex continues, it indicates that there's a central nervous system damage. So you should actually be concerned about that. Then we have what we call the gallant reflex. It's also called the swimming reflex. This one persists from birth to 9 months. So after 9 months, maybe like, when I mean 9 months, the baby is 9 months, not your pregnancy 9 months. So from birth to 9 months of age, you notice that your child is lying on their tummy. Now you just stroke along the spine. You could stroke from here down, any parts, just tracing along that spine. When you stroke it, the baby will definitely try to turn towards the side, and you know that, okay, this is fine. The baby is placed on their abdomen, you stroke along the spine, they tend to turn, trying to like get to where your hand is. Now, this should not persist after 9 months. If it persists after 9 months, then it means the child might likely have cerebral palsy. Then we have the Babinski reflex. This one starts from birth and can be there till 24 months. So some kids who are 2 years might still have their Babinski reflex, but from 3 years, it should no longer be there, and adults should not be having this. So it's stimulated by stroking the sole or the lateral side of the foot. Like this is your feet, and then you try to stroke here or the sole. We all tend to say, for those of us who we say we are very ticklish, so to speak, yes. But for the Babinski, what you get is that when you do that, the toes of the feet minus the big toe, they fan out and then they curl in. The persistence of this means that there's a damage to the nerve pathway between the spinal cord and the brain if this persists after 2 years. Remember what I said is that when you stroke it, the toes fan out and curl in involuntarily, like you can't even control it. Then there's a problem. Then we have the symmetric tonic reflex, also known as the crawling reflex. Let's forget all the big grammar. Let's go with the crawling. So basically in sitting position, when you place your child in sitting, they tend to bend the upper body so that they can, it is like a propelling towards crawling. They are placed in sitting, and the next thing is they're trying to push forward to move. That is what it is supposed to actually look like. It can start to appear from 6 months. Anything within 6 to 9 months is fine. So it doesn't mean if your child is 7 months and you've not seen the crawling reflex that there's something wrong. No. Some children take longer time than others. But the most is 9 months. Any child who is 9 months latest should already be having that crawling reflex, that when he or she is placed in a sitting position, next thing is they're trying to push forward to crawl. Then the crawling reflex can be there for up to like 12 months. Reflex in the sense that the child is placed in sitting and he or she tries to move forward. Doesn't mean that your child cannot still crawl after 12 months. No, but it becomes a voluntary thing now that when they are placed, they might decide not to crawl, and it doesn't mean there's a problem. Now, it helps the baby to learn to move the upper part of the body independently from the lower one. That is the essence of this reflex. It helps them to push onto their hands and their feet. It helps with posture development. It helps with hand-eye coordination. Now, if it is not properly integrated, it might affect the forward crawling. If it's retained, it might result in difficulty writing and reading because of the poor hand-to-eye coordination that I mentioned earlier. Then it can also cause reduced upper arm strength if it is not properly integrated. It can also, there might be problems sitting, or the child will just prepare to lie on the floor. So you see some kids and they're 11 months and parents will be like, you place them in sitting and they don't try to move, and then there is actually a problem. It can delay the crawling, or the child can even skip crawling altogether. And that is when you now see some cases where there's something we call bear walking. That's children who walk on their hands and feet. They're walking on all fours, like four-legged animals. So like this reflex is, I think it's something very major that from 6 months, you place your child in sitting, the child should try to move forward, try to push to like, oh, I want to crawl. But remember what I said, it doesn't mean if a child of 7 months is not reaching here, there's a problem. 6 to 9 months is when this should start appearing. Then it can start to integrate from 12 months, that is a year, which means the child will no longer feel that urge to push out and crawl, because now they are trying to do more things like walking and all that. Then we have the tonic labyrinth reflex. So basically you place your child is a line facing up. Now let's say you try to move the neck, like child is lying and you try to move the neck up, the shoulder would go back and the legs would come up. Remember what I said, your child is lying facing up. The neck, you try to raise the neck of the baby, the shoulder automatically goes behind and the legs come up. So this appears at birth and it can be there till 3 years, depending on, every child has different developmental pattern. But anything more than 3 years, then you might start to worry because it's not supposed to be there past 3 years. This particular reflex helps for head control. It is what actually helps the child to move the neck against gravity. That is why I can stand here today and I can decide, okay, this is where I want to move my neck. My neck is not going in line with gravity. I decide what I want to do, which direction I want to take it. this is the reflex that actually helps with that. It also helps with visual tracking, in the sense that, let's say something is passing and I want to follow it, and I can just look. That is what this reflex is supposed to integrate to turn into. So it shouldn't persist after 3 years. Now, it's also very important during childbirth. This is one reflex that, because remember, these reflexes, some of them are formed during gestation. This particular one is important during childbirth to avoid suffocation, because the child has to be able to like push that neck, and then that is the first response to gravity. If it's not there, then sometimes, most times, they might have challenges delivering such babies. Now, if it persists above 3 years, if it stays longer than 3 years, it starts to affect some functional activities. The child cannot roll, there's poor posture. Sometimes there's even vision problems. Remember, I said it allows you to vision track. Something moves and you want to follow it. For children who can't do that, there's vision problems, because you try to, okay, oh, maybe you bring something close to them to move it, and they will not even follow the object. It becomes a problem. Sometimes there's even like speech and auditory difficulties. There's toe walking for some of them, because remember, it's the first response to gravity at childbirth. So this should not be retained above 3 years. And remember what I said the reflex looks like. The baby's neck, you try to raise it up, the shoulder goes back and the legs come. And sometimes if this reflex persists, it can lead to motion sickness. People who, when they move, they tend to not feel okay. Over time, it can start to cause subluxation or dislocation of the head of the femur from the acetabulum, because everything is not working properly. So when this reflex persists, like, but this one is like in the dire cases though, you'd notice that the child starts to have dislocations and subluxation. Then the plantar grasp reflex. So this is your thumb. You press your thumb against the sole of the foot, just behind the toes, and the baby tends to just spread the toes out. That's what it's supposed to. Just your thumb against, this is your feet now, these are your toes. You press the thumb here, and the baby's toes tend to flex out. So it's kind of called the readiness tester, in the sense that it gives room for them to start standing and walking on their own. Absence of this might mean your child has cerebral palsy. An absence of it too can lead to poor balance and incoordination, and also unsteady with gait. You see children who, when they try to walk, they are wobbling and they can't hold themselves up. Now, the placing reflex, that is when you hold the child up. Basically, this can start to appear from 6 weeks. So yes, so you hold the child up, then you try to trace their feet along the edge of a table. You'd notice that they try to fold their knees, like you're carrying your baby and you're trying to be like, and then you notice they try to fold their knees. This is there from like 6 weeks to 6 months or thereabouts. A child of 8 months should no longer be folding their knees when you try to place them to stand, because they should already be preparing, remember, the crawling reflex for that. So it actually stimulates the walking step action. That is the essence of this particular reflex. If it persists, it means there's a neurological abnormality. Then I mentioned the eye blink reflex earlier. It's also known as the corneal reflex. So if, for example, there's a sudden light, or maybe an object comes, your baby tries to involuntarily blink. It's supposed to be like that. So you can, to test this out, you can just distract them to gaze upwards, and you lightly just try to touch the corner. You'd see that there's a reflex blinking of both eyes. This appears at birth. Then the essence of this, actually, I know we all think our blinking is we just blink. It actually cleans and lubricates the eye, and it also protects your eyeballs against irritation. So if there's an absence of the blink reflex, it means there's a facial nerve palsy. If your child doesn't have the blink reflex, there's possibly a facial nerve paralysis. Then we have the Babkin reflex. This is different from the Babinski reflex I said before. Babinski, remember, the toe. Now, the Babkin reflex, you press your thumbs against the two palms. Your child is lying down and you press your palms against your thumb against the two palms. The child rotates the neck and closes the eye and they open the mouth. It's like I said, we can't even explain these things. So you place your thumb here, your child tends to open their mouth and they try to rotate the neck. This is present at birth and it's there till 4 months. Now, the thing is, this one apparently is linked to the brainstem development. It helps with development of the brainstem. Then it also helps with coordination of the hand, the eye, and the mouth. Remember, I said you place your thumb in the palm of your baby and the baby's neck rotates. So it helps with, it links the coordination of hand, eye, and mouth. And this reflex is important for eating. So I know we all love food, right? Food is life. So basically, for people who are going to eat without issues, this reflex is important. If this reflex is retained, it means there's a problem with the hand and motor control, like the hand movement control. That's what I mean. And sometimes it can even lead to speech difficulties and delay. You see children who are like 2 and they can't form words. They can't form sounds and or whatnot. And sometimes too, it can lead to involuntary movements of the mouth and tongue when the child makes use of the hands. Now we have the parachute reflex. That's what a parachute looks like most times. So when a baby is held upright and you're carrying a baby and the body is just rotated quickly to face forward as if about to fall, they will definitely extend the arms forward as if to break their fall. It's like, I'm here now and I want to fall. I will definitely want to catch myself like that. So that is what you're going to see. This reflex actually helps the child to prevent injury due to falling. And this one never integrates. That's why I said, even when you're here now and you want to fall, you try to catch yourself. So, it's present at birth and it's present, from 6 months. That is when you start to see this. 6 or 7 months, any of them is fine. That's when you start to see this, and it helps the child to prevent falling. It indicates that there's a healthy neuromotor development. For your child to have this and be able to do this, it means the child is developing properly because he or she is able to react to a stimulus such as falling. Now, if there is a delay in this or it persists, it may indicate what we call hemiparesis. That is weakness of one side of the body. It means one side of the body might actually be weak. So it's something you can still go in, have checked out, and then Also, absence too might indicate a spinal cord lesion. It might mean there's a problem with the baby's spine, and sometimes it might indicate what we call a brachial plexus lesion. The brachial plexus is the part of the body that's the neck and the upper arm. So that is that about the parachute reflex. Now we know the stepping reflex, also known as the walking reflex. When you hold your baby upright and then the sole of the foot is against a flat surface, they tend to want to do, the thing that imitates walking. So it's there, it appears at birth, it can be there. The thing about this reflex is it appears at birth first, then it disappears around 3 to 4 months. Then it comes back at 8 months and is there till 2 years again. So remember I said it's there at birth, 3 to 4 months, it disappears. Then it comes back at 8 months and it can be there till 2 years. before it leaves. So you place your baby and they're trying to imitate the walking. And basically, it prepares children for voluntary walking. That's why it was called the stepping reflex. It prepares them for them to be. So the fact that we all can walk on our own now, that we can move, was as a result of this particular reflex. Now, if this reflex doesn't, like, comes before time, remember I said at birth 3 to 4 months, then it comes back again at 8 months. It means the child will not walk properly. The child might probably be walking like with the toe to heel, like their heel is up, and then they're trying to walk with the heel of the feet. So that's something to look out for. It also means that there is poor balance and motor control. If this persists, or if it comes before it's supposed to come, then also it could signify that the calf muscles are tight, which is something the baby could be brought in for physiotherapy, and that will be taken care of. Then it also means that this child, if maybe peradventure it does come back, the child might be having recurrent hamstring injuries. The hamstrings are the part of the muscles that are just like at the back of the legs. The child or the person might have recurrent hamstring injuries. Then also the importance of this reflex also shows that there is proof or recognition of locomotion possibility for this child. The fact that, like, you place your baby on the hard surface and he or she is able to want to do the stepping, it means that the brain recognizes that, okay, actually at some point we're going to be doing this. So it means there's a locomotion possibility for the child. It means like everything is intact. Then if maybe for some children who this doesn't come in for, it means that sometimes one side of the body might actually be the problem. And remember, I want to emphasize on this again, that it appears at birth and is there to 3 to 4 months and disappears, then comes back at 8 months and can be there till 2 years. So basically, yes. And then the EBR reflex, this one is there to clean and lubricate the eye. Basically, the way to test for this, you could bring a cotton wool and try to maybe stimulate the under eye of the baby. You'd notice that there's a turning of the face away from there and the blinking too. The reflex exists to clean and lubricate the eye, and the importance is that it protects the eyeballs against irritation. Okay. Okay, and then there's the placing reflex. So the placing reflex, the baby is held along the vertical edge of a table. This is a table. The baby is held there. You'd notice that at the edge, they try to fold the knee and then the hip before they finally place it. They try to fold the knee before it is finally placed on the surface. This one too also helps to stimulate the walking step. It helps to stimulate the walking movement. It appears at 6 weeks and can be there from 4 to 6 months. Now, remember, babies' developments are different. If you notice, the reflexes I've been talking about, there's always a range, because we can't say this is supposed to be at 6 months. So anyone who does it maybe 7 months or thereabouts is lagging behind. That is why there's a range. So if maybe your baby's own integrate like leaves at 5 months, it's fine. 4 months, that's why there is a range. So for this particular one, it appears at 6 weeks and it's there from 4 to 6 months. So we'll be talking about the last 1. Okay. Yes, and that's the PGR reflex. This one appears at birth and lives around 9 to 12 months. Remember the range thing we spoke about? 9 months, 10 months, 11 months, 12 months. That is when you could be looking at it disappearing. So this is when you carry a child and you try to just do a slight movement of their feet across maybe the table or your hard surface. You'd notice that they tend to curl the toes like this in response to the movement you're doing. This is also a preparation for walking. So absence of this means the child might probably have cerebral palsy. So I know I've spoken about a lot of reflexes here, and obviously nobody is a memory card to download all those things just in this time in their head. So we're here for your questions. We're here for, basically, like I said, this is just to propel. Nobody's going to carry all these things I just said and put in their head. So we're open to your questions. You can come in for one-on-one consultation inquiries if you feel maybe something I spoke about resonated with you, or maybe your baby isn't doing. You could even come even if you feel like, okay, I just want to get my baby checked out. We're here for your questions. And I'm here for questions now. Like, I'm ready to answer your questions right now. So any questions you have, please bring them forward and I will answer to the best of my knowledge. So that is it for the baby reflexes you're supposed to be expecting. And this is good for both expectant mothers, for those who are almost due for delivery, for those who have their babies already. The essence of this is your mind is there. In as much as I said all these things, the truth is all of them might not stick word for word, but trust me, you can't have listened to this and say maybe you've not picked up one or two things. At least now there's some reflexes you know you're supposed to look out for. And if maybe you're not seeing or if you're not clear, you can actually ask questions about. So it helps for you to know that, okay, my baby is supposed to be doing this at this time and he or she is not doing it. Or this is supposed to have stopped and it hasn't stopped. Or this is supposed to have started and it has not started. So that is basically the essence of this. Because sometimes you'd see some children come in with some conditions and you realize that it's been like it has gone way beyond, which is something, and sometimes it's ignorance because the parents don't know. So you realize that if it's something you can catch on time, you can actually take care of it. It's something that is easily like attended to. But sometimes because you don't know, the neurological deficit, it's just there and it keeps on getting worse and it keeps on getting worse. And then they'll tell you, oh, he or she will still do it. That's why I said there's a time frame. There's a time frame that would elapse and you know that no, this is now, this is supposed to have started or this is supposed to have ended. So I think that concludes my talk on the webinar today, and we're waiting for your questions.
Okay, good morning, Dr. Mitchell.
Hi, good morning, good luck. Dr. Good luck, how are you doing?
Fine, thank God. Thank you for your wonderful
Dr. Good luck is a new father.
And the way you educate us, automatically, that's why I'm coming in now. Because I want you to even keep in something that I wanted to find out. Okay, now for what thing you said, okay, it seems like, experience is the best teacher. It seems like I'm seeing it and I'm seeing other ones. So what I want to ask is, one, okay, what if adding from what you said and from what we know, that a child will sit between 5, 6 months, right? Sitting. So, but now my child started sitting in 2 months, 2 weeks. So will happen? What are you going to tell me about it?
Okay, the truth is, some babies are actually very fast. You know, that was why I remember I said something that these things, there's a range that it's supposed to have. Normally, a child is expected to sit at 5, 6 months. That's like the norm. And they would even like, why we even know that basically a child is supposed to walk at 12 months. But if you notice, some children walk at 11 months, some children walk at 10 months. Some children work at 9 months.
Of course.
Yes, exactly. So that was why I said it's good to come in for a consultation. If you see something that you're like, it's supposed to be there, that it's better there is no problem than there's a problem. So in the case of your child, now your child who you said sits at 2 months, there's absolutely no problem. You understand? Some children actually develop faster than the others. But that's the thing. Now you watch. The fact that this child is sitting at 2 months, trust me, he or she may be working at 10 or 11 months. Do you understand? Because his own development now is faster than the normal one. It doesn't mean there's a problem. Yes.
Okay, thank you very much for that.
Yes, there's no problem at all. It just means that you now, you're in the know. So yeah, okay, he sits at this age. And if you notice, so you said experience. So I'm sure something I mentioned, you were already seeing it and all that. So the fact that he's sitting now, I'm very sure very soon he should be on his way to crawling.
Yes.
Exactly. So those are the stages. But you know, when some people don't know these things, maybe, and most times the delay is the problem. The one that appears early most times is not an issue. Because like you said, a child who sits early, that's fine. You cannot tell a child that walked at 10 months that he or she should not walk because supposed to walk at a year. But it's good for parents to know that, okay, a child of 8 months that is not sitting, there's a problem. Don't believe that he will still do it. The maximum, like, okay, let's say the child is slow. At least like 7 months, you should be able to sit with your spine, like, you know. But then at 8 months, and you can't even hold it, you place the child and he or she is falling, then you know that, okay, there's a problem. So don't worry, there's nothing wrong with our child. He is a fast learner.
Thank you very much.
All right.
Thank you for a good enlightenment.
Call it. I can. Okay, so I just got a question from Kimberly Oma. Thank you for that. So she's asking, how do you manage a child who has neck problems as well as torticollis? Now, first of all, when you say neck problem could be a range of, like, it has different ranges. So for the torticollis now, the truth is, in as much as, okay, I know that this is a stiffness of the neck, your baby would, or your child would need to come in for us to do an assessment, because I can't say this is what to do. In as much as this is there are degrees to these things. Now, if I tell you, okay, neck problem, do this and this and this, the neck problem could be anything. It could be maybe from the asymmetrical tonic reflex, where the child is not moving the neck to this side. So we need to know what the exact neck problem is. And then the torticollis, to know how bad it is. There are some that come in and it's not so much, and you can see that within 2 or 3 sessions, the person is fine. And then some will come in and they'll need longer than that. So it's not something I will tell you, just do this and then it will go. We'll actually need to see this person one-on-one to know the degree and to know the variant of the said torticollis, and then to know the type of neck problem we're dealing with. So feel free to come in. Our assessment is free. You're not even paying. We'll assess and then we'll tell you what to do. It's free. And Yes, and then, like after the assessment, as time goes, we can now, decide, okay, if this person needs more or if this is it. But it's good to, I feel like anybody can take advantage of the free assessment. Come in and check first. If there's no problem, we'll just tell you, okay, this, and you can still come back another time and be like, okay, this is what I noticed. We'll still, attend to you. You understand? So yes, you can take advantage of the free assessment to ask all the questions you have. I will gladly answer them. Even my colleagues will gladly answer them, because all of us we're all trained in the same way and everything. So for the neck pain and the torticollis, we would need to actually see the level of what we're dealing with. Okay, so there's another question. Can a child with delayed developmental milestone present with scoliosis? Absolutely. Scoliosis sometimes it comes as let me say, a second package deal. Like there's a condition already going on, then the scoliosis now is part of it. Sometimes the scoliosis develops as a result of that underlying condition. So absolutely, a child who has delayed developmental milestone can actually have scoliosis. And the thing is, the earlier it is managed, the better. Scoliosis, we in the medical line, we know that there are certain degrees of scoliosis that you can attend to. Now, once scoliosis gets to the angle of 45 degrees, you're looking at surgery. Meanwhile, this is something you could have easily attended to, and you don't have to go through all the pains and all that. And we're not one of those who's going to come in here and just because we want to maybe take your money and lie to you. Any scoliosis above 45 degrees, most times you're looking at surgery because it has gone beyond what is obtainable. And there's also an age range. There's also an age range for this surgery. Most adults now cannot undergo scoliosis surgery because of the spine and all that. So yes, scoliosis is actually something that is known to sometimes accompany delayed developmental milestone. So you can bring in this child or this baby and we'll have a look at it and we'll know what to do and what not to do. So to answer your question, yes, scoliosis can actually is actually one of the things that DDM can come with. That's what okay. Okay, well, it's called delayed developmental milestone, which means what he or she's let me say what he or her peers were doing. Let me say, for example, her peers are sitting at 4 months, 5 months, 6 months. He or she will now, for those who will even sit, because most of them they don't, might now be sitting at maybe a year. It's delayed. So I'm not going to say 100 because nothing in the world is 100, but 95% of children who have delayed developmental milestone, they have speech problems because the talking is part of the development. So it's been delayed. So you'd notice that your child can't sometimes make sentences, can't form coherent sentences. It's actually like something that comes with DDM. So the speech difficulty, like you said, is a sign of developmental milestone. It is. It's a sign of DDM. To answer your question. So yes, thank you for that. Okay, so keep on sending in the questions. Keep on, yes, I'll keep attending to all of them. We're here to answer all your questions today. And down. Okay, so I'm going to read out the question I have here. So thank you, Dr. Michelle, for the wonderful presentation. You're welcome. My question is, does persistence or absence of any primitive reflex leads to having a health condition in the future as an adult? Absolutely. Now, what the person is asking is if maybe the absence or persistence of a certain reflex can lead to problems for the person in the future. And the answer is yes. Remember, there's a time some of them are supposed to stop. There's a time when they're supposed to be there. And now some, they're supposed to be present. So when this doesn't stop when it is supposed to, remember I said these reflexes exist so that they can integrate, that is, they can stop and then form voluntary movement pattern. That is voluntary movement that you can now do on your own. Remember, so when they don't do that, it's stopping you from something. The thing is just sometimes it might be one of those reflexes that is not so, let me say, not so vital. So the person doesn't notice that there's a hindrance. But absolutely, yes, persistence or absence of a primitive reflex can lead to having a health condition in the future as an adult. Absolutely true. Okay. Okay, so we have another question here that says, can Down syndrome lead to delayed developmental milestone? So first of all, I would have us to understand that Down syndrome is not something that has a cure. You can't say, oh, I've cured this person of Down syndrome, because it is something that is in the gene. Now, when your genes are forming, the X chromosome, the Y chromosome, they come together, and you're supposed to have a certain number. Now, Down syndrome, I think that's a trisomy 18. Now, when this, one of the causes is maybe alcohol, I don't know, some pregnant women drink, and then sometimes when the mother is advanced in age, this one is the like primary factor. When the mother is advanced in age, you'd see some women and they're having children or kids when they are like really advanced in age, and it doesn't help, because then your genes and the eggs and everything, they are not as vital as they used to be. So now, Down syndrome, the baby comes that way. Down syndrome on its own now already has some, let me say, problems. And these things now, they are going to impair. A kid with Down syndrome is most likely going to have delayed developmental milestone. So to answer your question, yes, Down syndrome, it doesn't cause delayed developmental milestone. The answer is that delayed developmental milestone, DDM, is actually like one of the, let me say, sometimes when I'm joking, you say you buy one, get one free. So Down syndrome is the one you're buying. The get one free is the DDM. So kids that have Down syndrome have DDM because it's part of, like, it's actually one of the signs of Down syndrome. It's one of the signs you look out for kids who have Down syndrome. The DDM is there. Their development is delayed. It's there. So to answer your question, yes, DDM is actually a byproduct of Down syndrome, but not that Down syndrome causes it, just that it's one of the things to look out. Do you understand? Exactly.
one of primitive reflexes is not present in an infant, what will you advise the parents to do?
Okay, so we have another question here that says, what if one of the primitive reflexes is not present in a child? What we advise the parents to do? First of all, like I said, go in for a consultation. Go and see a neurologist. Come and see a physiotherapist. They will make their own assessment. We will make our own assessment and know if it's something to be worried about or if it's something that's okay, this is totally fine. So if you notice your child doesn't have any of the reflex they're supposed to have, as a matter of fact, this webinar is being recorded and it's on our YouTube page. You can go there and save it so that you can listen to it over and over and you know what to look out for. You could listen to it later on, jot some things down and know what to expect. If you feel your child is not responding to something or your child doesn't have a particular reflex, please come in for a consultation. Assessment is free once again. Take advantage of that. Come in and make sure the coast is clear and there's nothing to be worried about so that you know that, okay, it's better you come in and we're like, okay, this is fine, or we start the treatment on time. So if you notice something is not going well, please come in and do an assessment and let's be sure of what is going on. Thank you. Okay, so the next question we have here is saying, is it possible that one or two of the reflex will be absent? The truth of the matter is, like I said, we're human beings. People have different, body. Let me say everybody's body is wired differently. It's actually very possible that one of these reflex might not come. Your baby might not exhibit one of them and the baby will be fine. Very possible. And it is still possible that the reflex will not come and your baby will not be fine. So that tomorrow you will not say, but Dr. Michelle said if one does not show, it is fine. It's very possible that a particular reflex might not show. The baby might not exhibit it. But trust me, that baby might still be fine. In some cases, the baby might not. So why would you want to bank on the baby not being fine, instead of coming in to be sure and make sure that the child is fine? Because each of these reflexes were made for like a particular purpose. Remember when I spoke about the rooting reflex? It gives way to the sucking reflex. The sucking reflex gives way to your voluntary eating. So it's very possible that maybe some kids might decide to, I don't need the rooting reflex, and they go straight to the sucking and they're fine. Meanwhile, some children might not have the rooting and they will not be fine. So once you notice there's a problem, please come in. But like I said, yes, a child might not exhibit one or two and be okay. But if you notice something, come in and check and be sure. That is what I've been hammering here. Early detection is key. It's better you come in and there's no problem than you sit and you're saying baby might be fine and then there's a huge problem. Okay. So the next question says, how long does it take for a baby to pick up these reflexes after treatment? First of all, it depends on the particular reflex I'm talking about. Now I'm going to digress a bit and tell you all like a little story of a child that was born and she didn't have the sucking reflex. She was actually in the special care baby unit when I was working at the teaching hospital in Gwagwalada. She was at the special care baby unit. So we came in, noticed she didn't have the sucking reflex. So my chief then and then we did what we call stimulation for her. There's actually like, there's something you wear and then you stimulate. We know the particular muscles and the nerves we're aiming for. We know what we want to do. After the stimulation, our baby's sucking reflex came back in just 2 days. 2 days only, and her sucking reflex was back. This is a baby that when she was born, it wasn't there. And that's the thing, because She was in the special care baby unit. We were coming every day to check, and we noticed these reflexes in there. We started the treatment. 2 days, our reflex came back. So it depends on the reflex that is absent. It depends on the baby too, because like I said, we humans are different. Two people might have the same health condition, but the pain level is not the same. And that's the same way recovery process is not the same. Two people might be sick, malaria, but one will get health, one will get well faster than the other one. It doesn't mean the other one will not be fine. I'm just saying a lot of things come into recovery. Number one is the person's body and the person too. Because sometimes it's just your body is taking longer time to respond, or some people's body responds faster. Two, secondly, the prognosis, because it depends on the reflex you're working with. Some reflexes, actually, you notice they are not there. You start working on them. They might, like the sucking reflex, it will be back in no time. Some reflexes, you start working on them, and before you know it, they're actually back, while some might take longer. The fact that like we saw our baby and in 2 days her sucking reflex came back doesn't mean the next child, his or her stepping reflex, will be back in 2 days. So basically, in summary, what I'm saying is to say this is when this will be back. It depends on the reflex you are dealing with. But trust me, like I said, the sucking reflex should be back in no time. That was my first experience. There was a 6-year-old child who I handled too. This is 6 years. She had what we call acute viral encephalitis. This is someone who had developed her. She was fine. She's 6-year-old. She was eating well. But the sucking reflex disappeared. And in the space of 3 days, it was back as we started management. So like I said, some reflexes take longer to respond, while some, they might, just respond like on the spot of the moment as you're working on it. So for me to say this is when it will respond, it depends on the reflex. It depends on the baby. It depends on how old the baby is. Remember I said early detection. These ones that came into the hospital, we picked it up early. That is the key, early detection. Because a child who has stayed for like years cannot come in and expect someone who the parents brought in immediately to. And another thing is patience. Patience is key. When you're dealing with pediatrics, if you're not a patient person, you will get frustrated, both as a physical therapist and as a parent. You have to be very patient because most of their cases takes time, takes dedication. It takes you actually understanding that, I'm going to have to get this person back on their feet by hook or by crook. So, as a matter of fact, let me digress again and just say something very... I remember when my younger sister was born, that was my first encounter with physiotherapy, as a matter of fact. I was 8 years old. My sister was born with Erb's paralysis. This is what happens when they are delivering a baby and then there's a problem and the brachial plexus is broken. It's only physiotherapy that can attend to that. My sister was attended to for 2 years straight, back-to-back physiotherapy. My parents were very knowledgeable, thank God. They had someone coming to the house. Her treatment was... She's 19 years old now and she's perfect. You would not even know that as a baby anything happened. That was my first experience with therapy, and that was when I saw. I was like, okay, I actually want to do something like this. So my point is, patience is key. When maybe your baby is going through something, don't expect that maybe in a matter of seconds this child will be fine. You have to just relax and trust that your child is in good hands. So like I said, it depends on the reflex that is absent. It depends on how old the baby is. It depends on the particular child too. So all these things add to the prognosis. But trust me, you come to Amazing Physiotherapy, you're in perfect hands. Everything, you will definitely get results. I mean, our testimonials are proof. So we have specialists across every sector, every unit. You will definitely get the utmost care for your child. And as I said, our webinar is recorded because I know everybody cannot assimilate this at once. Just go back to our YouTube page and you can just take your time, jot down some things. If you have questions, you can Google us. Our numbers are there. You just call and you can speak to someone. So yes. All right. So thank you for joining us. We appreciate another webinar that you all were present for. Look forward to seeing you next month. Bye.
Let's give it a round of applause to our teacher, not even a guest or a host here. I guess you all have learned one or two. I learned a lot. Can you hear from my voice? I've learned about movement. When I get pregnant now, I'll learn how my baby will move. When I give birth, everything. So I've learned a whole lot today. We have this recorded, as she has said. We have it on our YouTube, our Facebook. We're also live on Instagram. I forgot to mention that. So we can all go back. You listen to everything she has said, word to word. Let's learn the few things we've said here today. And guys, I don't know if you guys know, this webinar is being held every last Friday of the month. Every last Friday of the month, we come here and we talk about different topics that affect our general life. And I can't wait for you guys to be with us again next week. So not next week. Okay, next week we're having a giveaway program. So I'm interested in that giveaway. So as I mentioned next week. Next month, last Friday of the month in November, we're going to be here. I'm going to be talking about cerebral palsy. And this is also going to be it's like a continuation of where we stopped today. And I can't wait for us to have that. We have our head of clinicals who's going to be the one hosting us. So I can't wait for you guys to join us. Last Friday of the month is when we hold our webinar. Please, guys, join us, ask us questions. Anything that is bothering you, talk to us. We are here. We have clinic in Lagos, Abuja, Enugu, and Port Harcourt. We have professional doctors. What are you looking for? A chiropractor? We have them. We have professionals. You have back pain, lower back pain, upper back pain, shoulder pain, knee pain, kind of pain. We are here to help you heal without surgery, without medication. That is what amazing physiotherapy is all about. Guys, I can't wait for you to come into any of our clinic. Right now, we have a free assessment going on. Enter, book an appointment, join, listen to us, follow us on all our social media platforms, Instagram, Facebook, YouTube, so you see what next we are dropping. And like I just said, next week is our giveaway. So we do giveaway every first of every month. And I can't wait for you guys to join in. As you have joined here, everybody that stayed with us from the beginning till the end, you guys might just be one of our winners. So you guys should please join us again next week, Thursday. Oh, next week, Friday is 1st of November. So join us next week, Friday, for another amazing thing that is going to happening here in the studio. Please, guys, thank you for joining. Thank you for sticking with us. Thank you for trusting us with everything. We love you guys and we do not take it for granted. Thank you, guys. We love you and we look forward to seeing you in our next webinar. Thank you so much, Dr. Michelle. Thank you to everyone in the studio, my table director, and thank you so much. Thank you, guys. You guys are just the best, and we will do this again next time. So see you guys in our next webinar. Bye, guys. Bye.